Good to go. So, hi everyone, and thank you for joining this session. It's awesome to be here at the HPMA conference and presenting to you on this topic, which is how the NHS, how healthcare providers can support staff in times of crisis and develop a resilient workforce. So my name is Coppelia Rose. Folks call me Rosie, it's easier. And I'm the Global Healthcare and Life Sciences Leader for DXC Technology's SAP practice. So SAP sponsoring the session today. DXC are platinum partners of SAP. And I'm coming to you from Brisbane, Australia, and it's really great to be here. So, how do healthcare providers support staff in times of crisis and develop a resilient workforce? So, from my perspective and from my observation, and what I'd like to talk to you about today is it's about managing stress. So, there's two things there. There's supporting staff in a time of crisis, so supporting staff through stress, during stress, and developing a resilient workforce. So, developing the resilience to manage stress in the future. And a resilient workforce is really a resilience in individuals, but then in those individuals forming a greater workforce and resilience to an organisation as well. So to talk about stress and a bit of a timeline here for healthcare workers, and I know you would all be acutely aware of some of these indicators, but I'm just going to run it through, and this is the journey that we've been on from a technology perspective. So last year when we started seeing stress in healthcare workers increase, it was very, very apparent that frontline healthcare workers already face stress in their roles. So pre-pandemic, you can see, down here, there was already in 2019 a survey that stress and burnout was high in healthcare workers. Then we ended up with the pandemic. So about July last year, we started seeing this, especially there's more stress now. And then we get to December last year, and this is another US survey, but this one is showing that 93% of people surveyed by December in the healthcare workforce, 93% of folks were experiencing stress. They were feeling stressed out and stretched too thin. So this is actually now, it's not just a peak in stress. This is actually a long sort of stressful period. And then more recently, so research now, so we've had the time to actually do some research, and we can see that these high stress roles, these healthcare roles that were already stressful, combined with the unique demands of this pandemic, have undoubtedly placed frontline healthcare workers at more risk, essentially. So what does this mean? What is this long stress? So we've heard about long COVID, and here we're talking about this, is it long stress? And what are these stresses and where are they coming from? And so what I've been, from my observations and just from the research that we've been doing as technologists, we're seeing stress coming from peak in service demand. So that's the peak in demand on services, healthcare services, because of the pandemic. And that peak in service demand then stresses the organisation, and then also that stresses the individuals. Now, peak in service demand isn't necessarily something new. It's historically seasonal with influenza. It can be caused by significant accidents, global incidents, or natural disasters. So different regions and different facilities will have peaks in service demand at different times. But whenever there's a peak in service demand, the hours and conditions of those working changes, and that's what we have had for this long period now. So this peak in demand that wasn't even really a peak, it's sort of come up as a table, it's plateaued, and we've got up to 1 in 5 people working in different areas. And I actually heard today that could be as high as 1 in 2 people. And people seem to be asking their teams to work harder and longer, and we just sort of can't move in that direction sort of much longer. But we've got to keep in mind that this is something that historically has happened and is continuing at the moment. We've also got situational stress. Now, where we are at the moment, situational stress sort of looks like lockdowns and homeschooling and illness and bereavement and different services having a priority, and then other services taking a back step because of treatment programs, etc. So situational stress, hopefully, and I've put the little fingers crossed here, is very current and hopefully passing, although I know from a Northern Hemisphere perspective you are moving into cooler months, which can actually increase increase some of that peak in service demand again, so feeding up into that higher one. And I've even noticed some of the European countries moving into other lockdowns and waves, etc. So that's unfortunate, but that hopefully will pass. And then we've got staff shortages. So that's another thing that we've observed that's causing stress. And it's causing stress on organisations, and that, of course, it causes stress on the individuals as well. So when we're talking about how to build the resilience, we need to identify where these issues are. So staff shortages are, they're really, really high at the moment. There's this term, the global resignation, that we're hearing. It's something that's not just the healthcare industry. It's, folks have taken this time to assess, is this where I want to be working? Is this what I want to be doing? Is this the income that I'm set to have? Is this where I want to be living? And so the Great Resignation is causing a bit of a shake-up and a shift, and people are actually changing roles, changing employers, even if they're not changing vocation. And, I've heard that, in the States, in a global role, so I get, information from different areas, but one of the surveys recently suggested that 92% of nurses are looking at changing roles, not necessarily leaving the profession, but changing roles, changing employers, maybe moving to what they call travel nurses in the US, which we call agency nurses here, or contract nurses working through an agency. So staff shortages will happen through that Great Resignation. I've heard that in the UK, I was listening to the NHS provider podcast, there's up to 90,000 vacancies in the NHS at the moment. So we know that there are staff shortages there. And we're going to see more through people that have postponed retirement or postponed leaves of service, etc., long service leave, because they've wanted to stay and help the team, but they need to take that break. And so we're going to start seeing more shortages. There's also been, border restrictions and travel that would normally have occurred, and people working. But this was also a pre-existing condition to the pandemic, and it was really exacerbated by the pandemic, and it's ongoing, but it was a pre-existing condition. So when we started looking at some of these stresses and some of these things that were pre-existing conditions from a technology perspective, and how can we help the industry, what we started to see that was there were general workforce management principles that were actually present for up to about the last 15 years. So yes, we could see that the healthcare provider workforce was under significant stress with the pandemic, but it was actually amplifying existing issues. So this is just a little bit of a timeline, and I've got all of these resources. If anyone's wanting them, by all means reach out. But this is a bit of a timeline that there are various global or various regional but significant calls to action to the industry to do something about workforce management in the health sector. So that's recruitment, retention, performance management, providing learning, either just-in-time learning or role-specific training, actually handling compensation and rewards differently, motivation, and being able to engage with their employees in a meaningful way. So these workforce management processes were lacking. And from a technology perspective, our analysis says that that's probably because in the last 20 years, there's been such an increase in clinical technology. Patient-facing front-end diagnostic systems, etc., have actually taken a larger portion of ICT budgets in the industry, and the back office systems like our HR systems, finance and procurement systems, etc., probably haven't had the same attention. So when we were looking at this last year, and we could see that, okay, there've been these various issues over time, we could kind of see why. But what we found where we had customers in the health sector that didn't have access to the skills and competencies and credentials of their team, when they all of a sudden had to start allocating people to new services and being able to assess what gaps they had and who needed to be increased in competency for various service delivery, etc. And so we even had customers that had hard copy photocopies of people's certifications and credentials in physical HR files, and just did not have that information readily readily available. And this was across all healthcare sectors, so aged care, community, acute care, etc. And that was just something that we thought, well, what can we do to support this and what can we do to help, given that's an ongoing problem, but we've now amplified it with the pandemic. So what we did is we actually assessed, okay, what are the requirements from a healthcare perspective in workforce management? And we did some functional mapping. Now, SAP solutions handle workforce management processes very, very well. And now that we've been working in this area for over a year now, we do also have some healthcare specific workforce management and talent management solutions. But what I really want to touch on today, because of the name of the topic of this particular session, is what we found there wasn't necessarily readily available in that set of SAP solutions that we work with. And that was the element around protecting and supporting the workforce. So we found that to be just as heavily required as recruitment and onboarding and workforce development, etc. Protecting and supporting was something that really came through as something we needed to do. And so we went on a bit of a journey, and we wanted to prioritise employee wellbeing, that protecting and supporting the workforce element. And so we did a bit more research and started looking at what elements or what was available to us from a technology perspective that we could start working on and start putting something together to support the organisations with this need. So something that kept coming up through various research was this peer support. So this is an article this year that supports what we started last year, but we found that peer support initiatives was something that we could start looking at providing some tools to underpin and try and help these resources. So there are, of course, numerous ways that resources can support themselves through stress and preventing burnout and building a support network and different activities. But peer support and providing resources were things that really came through. So these are just a few clips to support what we started. But what we actually did is we took a design thinking journey. And I wanted to talk about that a little bit because what we've done is really based on users' ideation in this design thinking process. Now, there's a lot on this page and you're not meant to necessarily see all of the detail. I just want to sort of touch on this journey that we went through. So what we did is we identified physicians, medics, counsellors, administrators, nurses, etc., to participate in design thinking so that we could develop some tools to support this peer support principle that we were looking at to help reduce the stress. We looked at what was already out there and then we engaged with these folks, and we had to do it virtually during COVID. And of course, people were very, very busy and it was really hard to get folks to attend the session. So we had to be very flexible, but we did identify resources from around the globe, some through our customers and some through our own professional networks. And we interviewed them through a process, an empathy process, and we interviewed them and developed personas. So we've got 3 personas here. That's what these cards are here. We've got a doctor persona, a social worker persona, and a nurse persona. And what that is, it's just an element that, or a persona that represents all of the needs that we were capturing through people of these types of roles. And we got them to really, through the ideation and design thinking sessions, we got them to really talk to us about common stresses and indicators for that stress, and ways they cope and things that would help them to cope if they had access to them through their experience. And this last picture on the right here is just showing all of those little design thinkings, like the post-it notes on the wall in a workshop, but we were doing it virtually online. So it's just to sort of show you that, you know, how extensive this was. But what we really did was brainstorm with them on how to transform their pain points or these common stresses into opportunities and things that we could develop into a tool that could support them. And in doing that, we came up with a solution, and I'm going to play a quick video here, and this should just refresh into be able to play, and you should be able to hear it, and then I'll talk to you a little bit about what it was that we've developed. So I'm hoping this is going to play.
It doesn't matter who we are or where we are. The daily struggle faced by many can be challenging. Everywhere we turn, there are things happening which impact our nations, regions, cities, and people. Our Our healthcare workers very often find themselves at the forefront of high-pressure environments and experience firsthand the stress of peak demand on healthcare services. Over and above challenging workloads, national emergencies, global incidents, significant accidents, and natural disasters can put additional pressure on the healthcare workforce, and the mental health implications can be huge. It has been said that our healthcare workers are the true superheroes. We have heard the stories and seen how the healthcare workforce support patients and the broader community. But what are the mental health impacts on those that are supporting others so tirelessly? And importantly, where do they find support? DXC Technology has been working to find a solution to a range of healthcare industry business needs and have developed a personal use support application as part of their workforce suite for healthcare offering. DXC Technology is proud to present to you Safe Space. Safe Space is an employee wellness support application specifically designed for frontline healthcare workers with frontline healthcare workers, enabling them to connect with each other for peer support, track their emotions, and find inspiration and support during peak times of stress, all in a safe space. Safe Space helps healthcare workers connect with others. Users can interact and share experiences, sentiments, and common interests with others in their field. Healthcare workers can find special interest communities by experience or interest. Safe Space is designed to be user-friendly with a simple interface and navigation and is completely secure. Privacy and anonymity is maintained through avatars, alias, and profiles for simple direct messaging, community group discussions, and content sharing. Safe Space allows healthcare workers to express how they feel, especially in stressful moments, quickly and easily. It is intuitive and allows for easy logging of a healthcare worker's mood using both expressions and words, with the ability to journal about what they're experiencing. It includes the ability to set a schedule for when the app will prompt for a current mood and to look back on trends and patterns over specified time intervals. By using Safe Space, healthcare workers can easily access information and care, such as their designated employee assistance program or service, as well as linking to additional support or assistance content. Safe Space provides healthcare workers with support when healthcare workers need it, to assist in reducing stress or managing a difficult day. Users can discover quick mood boosters and uplifting content through their communities, but there are also tips and prompts around breathing and mindfulness, exercise and meditation, inspiration and humour, as well as links to additional help and resources. With a vision to support healthcare workers through times of peak demand and stress, DXC Technology embarked on a journey of ideation and design thinking to fill a need within the workforce management solution suite offered to healthcare providers. Safe Space has been designed with healthcare workers for healthcare workers and allows them to do the things they said they needed an application like this to do: connect with others, express their feelings, and access the information and care they need. Our healthcare workers are the true heroes of humanity, and we need to ensure they are cared for. Contact us today to discover how you can arrange a safe space for your healthcare workers.
So I'll stop that before it jumps onto other YouTube clips and see if we can go ahead here. So that was just a bit of an intro, a bit of a promo for what we ended up with after we did that ideation and design thinking with the healthcare professionals. So it is DXC IP, it runs on SAP platforms. and it was designed by end users. Yes, psychological principles have been used, so the journaling and the mood tracking and even the peer support are all based on psychological principles. There's a wealth of security in there, etc. But it's really designed to support the things that the end users that we were engaging with said that they really needed. And some of the things that they said was that, you know, they wanted it to be secure. They wanted it to be anonymous. So they didn't necessarily want to be able to identify others in there, so that they weren't necessarily telling their peers and their supervisors that they weren't managing, but they could still talk to people that have been through similar experiences. And it's across boundaries as well. It's across different healthcare settings. It does link to an employee assistance, and it's not necessarily for daily use. It's really for peak times of stress and trauma, or going through a particular difficulty. It does allow tracking and self-monitoring, and it can trigger other elements. So it triggers other modules that we've developed in our workforce management set. And it can actually link into things like learning and that type of thing as well. So that's the journey we were on around how to support the healthcare workers through stress. But to build resilience, we also started looking at another tool as well. So this is another module in our set, and it came out of those design thinking sessions with all of the resources. So it's actually industry-leading software called Qualtrics, which is an SAP solution. But again, we've put some DXC IP in there, and we've developed a pool of industry-relevant questions around stress and burnout in particular. And the burnout elements are using what we call the Oldenburg burnout inventory measures. So it's actually an academic measure of burnout. And there are also questions in there around safety and protection, etc. So this allows an organisation to survey their staff, so various groups or cohorts of their staff around these things, but there are also elements to it that can provide feedback on demand as well. So again, it can be used during peak times of stress, provide a feedback channel so that an organisation knows where to be directing support and resources, and how their workforce is coping. So Qualtrics is a tool that's already used by a number of NHS trusts, as far as I'm aware. And we can actually we've actually got a sample of this survey that can be made available to you if you want to contact me through the chat. We can actually get in touch with you and offer you one of the sample surveys of some of these workforce questions that were derived through that design thinking process, into really trying to understand what the industry needs at the moment. So touching on these other workforce management elements. So these are things that, as I said, we have solutions to support. Things like understanding the talent pool, understanding your skills and competencies, developing resources into roles, filling learning gaps, etc. These are things that we have modules to support the organisation with, and we can actually assist in building sort of that resilience. So I understand that these are bigger, more digital transformation conversations, but they all sort of complement to look at a holistic care team wellbeing and a holistic organisational approach. What we've done is we've got some of these modules that touch on some of the recruitment, onboarding, succession development, etc., all based on skills and competencies. So I've just given a screenshot there of, for example, a registered nurse job profile. And I'm not sure if you can see it, but there's competencies and skills in there that link to all of these other areas, because building a workforce based on this knowledge of skills and competencies assists in being able to be strategic and being able to plan for things like peaks in service demand and to work through staff shortages in a slightly different way. This also covers contingent workers, as I mentioned, agency nurses before, and we've also got some elements of reporting and analytics. So in total, what we've done is we've called this set of solutions the DXC Workforce Suite for Healthcare, and it's using SAP solutions. So the module I just had a screenshot of, it sits across on these talent management side here. The survey tool that I showed you the screens for is our Module 6 Engage, and our mental health support piece, or the app we call Safe Space, is this Module 8 support here. So I won't go into too much detail of those. We can, of course, answer any questions about any of those elements, but they really are around that holistic workforce management approach and how that can be undertaken. Now, the long-term benefits. So we talked about sort of, coping, helping staff cope through times of stress and then building resilience. So the ability to do that using this holistic approach to workforce management is really about being able to cope with it happening again. And what is it? Well, it's anything sort of out of the ordinary, any what they call a black swan event, whether it's a pandemic or natural disaster or any peak in demand. So being able to be resilient as an organisation by having these workforce management processes in place and tools to support those processes, but also providing that resilience training and the tools to be resilient to the resources as well. So remember, resilient individuals assist in building a resilient organisation, and that can handle stress more. It's also about these workforce management elements really support improving service quality as well. So you can see things here: education and training, recognition and rewards, etc. They are elements that contribute to service quality. And it also talks to that moving from a triple aim to a quadruple aim. So many of you would understand that from a healthcare key quality criteria, the triple aim of improving patient experience, improving the health of the population, and reducing healthcare costs was something that healthcare organisations were aiming for, and various KPIs were set in place. And then it was established that, well, from this triple aim, none of those things could be achieved if we weren't looking after the care team wellbeing. So if we aren't looking after the resources that work in the healthcare sector, then we can't actually achieve those other three things. So that's actually moving now to this quadruple aim. And it's very, very underpinned by actually looking after the workforce, and not just from a payroll and a HR perspective, but from all of those. We've been hearing it through the sessions today, the development, the succession planning, the training, those types of elements to build this resilient workforce. And we need to be able to prevent burnout and manage stress in a way through individuals and through for the organisation as well. So in doing that, so my goal is to make employee wellness a core business process. So we, in technology and ERP solutions and SAP solutions, we talk about core business processes, payroll, there's accounts payable, those type of procurement, for example. But I would like to see employee wellbeing as a core business process, and that's the journey I'm on, and that's why I'm here talking to you today. So thank you very much for joining. And I hope you enjoy the rest of the conference.